Good morning, everybody. I'm Sayukta from Bladder Wellness Team. I'm sure all of you must be keeping good health. OAB or overactive bladder is a frequent and sudden urge to urinate that may be difficult to control. The condition is common and distressing and may have a large impact on the quality of life. In this month of World Continence Week, let's unite to raise awareness about incontinence related issues and its impact in the life of people living with it. To throw more light on the subject and guide us on what's right for diagnosis and treatment of OAB, today we have with us renowned Dr. Ved Bhaskar. Dr. Ved Bhaskar is senior consultant, urologist, andrologist, and transplant surgeon from Medanta Hospital, Lucknow. Dr. Ved Bhaskar is having rich experience in the field of urology and carries out the treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. A very good morning to you, Dr. Ved Bhaskar. Hope you are doing good, sir.
Thank you, Sangeeta. Thank you for the warm welcome and those words. Thank you so much.
Thank you. It's a pleasure to have you with us. And as we are celebrating World Continence Week, uh, and we will, in this session, talk about overactive bladder. Dr. Bhaskar, first of all, I would like to know the importance of World Continence Week. Why there is a need to celebrate it? हम क्यों celebrate करते हैं World Continence Week? क्या है ये?
Yeah, it's a very good question because I think not many people know about it. Continence is a major issue. If we see data, the data says more than 400 million people suffer from incontinence worldwide. And it is said like 1 in 8 person has some or other symptoms of overactive bladder, which is quite more than diabetes, osteoporosis, asthma. I mean, these kind of common diseases. Overactive bladder is even much more common than these kind of diseases. But it is not talked about much because people don't want to come up with the problems. And it's one of the data says that only 40% of the patients tell the clinicians about their problem. Rest of them hide the problems and do not discuss with the doctors. So it's a major health issue, but it is not much known, and we need to spread awareness about this problem among the people so that they come up with the problems and get themselves treated. So in 2008, by the World Incontinence Society in Cairo, there was a first meeting done in June, which was then continued every year, and it was planned that every year in the last week of June, from Monday to Saturday will be celebrated as World Continence Week. And so in 2022, we are having this week from 20th to 26th of June. And today we are in this World Continence Week. The main purpose of this week is to, have different awareness campaigns like we are doing one here. So it's going on throughout the world to let people know and make people aware that this is indeed a problem which needs to be catered. And it's not just like the people get treated for diabetes and osteoporosis, but they don't come forward for treatment of overactive bladder. So we need to spread awareness that it is a disease, it is curable, and we need to discuss more about it.
Fair enough. So that's the significance of World Continence Week, and we are here to spread awareness over overactive bladder or issues related to continence. So to start with, doctor, as today we are going to discuss about overactive bladder. What exactly is overactive bladder or OAB?
Yeah, actually, when we understand the anatomy of the urine system, bladder is a kind of reservoir which stores urine. When the kidney produces urine, so जब urine नीचे आता है, तो bladder kind of stores it. And whenever when the storage is kind of full, जब लगता है कि हाँ bladder full हो गया, तो we have a sensation to urinate. When we urinate, the bladder contracts and the sphincteric muscles relax so that the urine comes out of the bladder, and we are able to urinate. But if during the storing phase, if the bladder starts contracting, then it is a cause of overactive bladder. Basically, when the bladder should relax, it starts contracting. So patients has increased frequency and urgency to pass urine. उन्हें कई बार जाना पड़ता है, and when they have to go, they have to kindly rush to the bladder, because if they don't rush to the bladder, they might even leak urine. So it's called as urgency incontinence, which can be associated with without this thing. So basically, it is untimely contractions of bladder which is causing this kind of problem to the patients.
Right. As you have already mentioned, doctor, that it gives a sudden urge to urinate, or frequent urge of urination. Are these the only symptoms, or there are other major symptoms of OAB?
No, the major symptoms include increased urgency to urinate. It might be or might not be linked with leakage of urine. It is called incontinence in medical terms. But urgency and obviously increase in frequency is the main symptom of this. Now, when patients come to us with these kind of symptoms, first we have to evaluate the reasons. What are the causes for this? Because symptoms are just like patient saying, I have to wash a number of times and I'm not able to control my urine. I have to rush to the toilet. This is the main symptom which the patient complains. But then the symptoms are maybe just one or two, but the causes are many. There are umpteen number of causes which you have to find out. So we need a lot of time to talk to patients. When patients come to OPD, we at least spend 10, 15, 20 minutes understanding the reason for this problem. So treatment is not just medicines. It is like, a whole, gamut of, like from lifestyle changes to behavioral modification. It's a lot of things. So first we try to understand what basically the problem is, what is the cause of his overactive bladder. And then we, start telling him one by one, like, okay, these are the causes. You can just modify these things, and obviously we give medicines so that to help the patient along with the lifestyle changes. Medicines also work together.
राइट तो बहुत ही आम भाषा में जिसे हम कहते हैं कि यूरिनेट करना जो है कंट्रोल नहीं कर पा रहे हैं, तो वो एक मेजर सिम्टम है। लीकेज भी हो सकता है, लेकिन आपने बताया कि ये भी समझना जरूरी है कि इसके पीछे की वजह क्या है। व्हाट आर द कॉजेस रिस्पांसिबल फॉर ओएबी? नाउ आई वुड लाइक टू नो दैट एज यू हैव ऑलरेडी मेंशन्ड दैट देयर आर n number of reasons that can be responsible for an overactive bladder, but still any major causes of OAB, what are those?
Yeah, so if we start from number one cause, we can say is aging. Aging is a major risk factor for OAB because as age progresses, the bladder muscles also become weak, and in males, especially the prostatic gland enlarges with time. And so prostatic gland, which is called as generally BPH, or in few cases carcinoma prostate. So in both the cases, really the gland enlarges, and when the gland enlarges, it is one of the major causes of overactive bladder. So patients with symptoms of, because one of the symptoms of prostatic enlargement, which is we call as LU2S, lower urinary tract symptoms, is urgency and urgent incontinence. So quite a number of patients who have prostatic enlargement, along with the complaints of frequency and slow flow, they also complain of urgency and occasionally urgent incontinence. So one of the major risk factors in males is prostate gland enlargement, and in females with aging, they are another causes like UTI is one of the major causes of urgent incontinence. Next thing is obesity. When we put on weight, and then that weight of the abdomen on the bladder itself is one of the reasons which cause over bladder. Along with that, if patient has history of more of caffeinated drinks like tea and coffee intake, it is one of the major bladder irritants. And in young people, especially, it is seen alcohol and smoking are one of the major causes of overactive bladder. Smoking has been found to be more detrimental in younger age compared to older age, whereas other things usually affect with age. Also, along as age progresses, people usually become hypertensive, and they are on medications like diuretics, which causes increased frequency of urine, and because the amount of urine increases with the help with the medications, which they are on for cardiac reasons or for hypertension. So then other than this, diabetes is another reason, because if patient has diabetes, that itself will cause a lot of time patient to urinate, and so you have to run a number of times. Constipation is another major concern, because if patient has constipation and if the colon, if his bowel is loaded with fecal matter, it compresses the bladder and again causes urge to pee. So patient has to rush to the toilet again and again. So, and then finally, one category we call it idiopathic, where we don't know the reason. We try finding all the possible reasons, and sometimes we don't get any, but still the patient suffers. So it's called as idiopathic, where we cannot find any reason, but then still patient is having symptoms.
Right. So there are various reasons. One definitely is age, and as you have also mentioned, the prostate enlargement in men. Now, talking about that, because in benign prostate enlargement, the symptoms are same. With aging, also people loses the control over, peeing, etc. So the symptoms almost are same. Even with diabetes, patients have this urge to go often to the washroom to release themselves. Now, are there chances, or have you seen cases? I'm sure you have, where people have, by themselves, उन्होंने सोच लिया कि नहीं नहीं ये तो मेरा एजिंग का इशू है, ये तो होगा ही, या प्रोस्टेट का रिलेटेड इशू होगा है ही, डायबिटीज है इसलिए मुझे बार बार वॉशरूम जाना ही होता है, तो डॉक्टर को दिखाने की क्या जरूरत है, ये तो होगा ही, आई हैव टू लिव विद इट, ये होता है सिनेरियो?
Yes, yes, very rightly said, very rightly said. Because main patients, number of patients we see in our OPD has this same complaint. When I ask him, first they don't tell themselves कि हमें problem है. When I ask them leading questions कि क्या आपको ये problem होती है, तो रात में उठना पड़ता है, कई बार जाना पड़ता है, यूरिन कंट्रोल नहीं कर पाते हैं, तो then they start coming up, हाँ डॉक्टर साहब ये तो डायबिटीज मुझे है ही, तो ये प्रॉब्लम तो रहेगा ही, या फिर मेरा एज हो गया तो ये तो इस एज में होता ही है. So these are the questions when we ask the patients, they are like so casual about it कि तो चलो ये तो इससे तो everybody has this in this age, so मुझे भी एज के साथ हो रहा है, तो ये तो करना ही पड़ता है इस एज में. Then I tell them it's not like with age and all, it's like it's major thing. I mean, because your prostate is enlarged, and most probably that is the reason for all the symptoms. Obviously, diabetes is one factor, but if diabetes is well controlled, तो वो नहीं करेगा problem आपको. And age itself is not the culprit. Age के साथ जो changes आती हैं body में, जो problems आती हैं, जो दवाइयाँ आप लेते हैं, उसकी वजह से problem होती है. And obviously, some amount of thing, muscle weakness and all is possible. So then we guide them कि नहीं, problem is treatable. It is not like they have to live with it. And yes, misconception जो आपको दिमाग से निकालना चाहिए. And I think this is a very big misconception in everybody's mind. So this should be very clear to the public that it is not the age factor alone which is causing all the symptoms and other problems like diabetes, and because these are all treatable causes and we can easily treat them and we can take things under control, and it's not like you have to live with it forever.
Right, right. I think that's the important thing, it's curable, it's treatable. So please, if you see any of the symptoms, go and meet your urologist. That's important. Doctor, आपने जो बताया कि इस तरह का casual attitude जो है कई बार patients जो है अपना लेते हैं कि aging का effect है, diabetes की वजह से है या दूसरी तमाम वजहें, और ऐसे में they don't go and meet their urologist, they end up delaying the whole thing. और एक और चीज होती है कि हमें actually पता नहीं होता कि ये symptoms कब शुरू हुए, वो तो धीरे धीरे शुरू होते हैं फिर बढ़ते हैं, तो कोई पूछे भी तो हमको लगता है कि नहीं अब तो बहुत टाइम हो गया, we have mentally started adopting to the situation etc. So ऐसे में अगर डिले होता है और बहुत टाइम बाद जाके वो डॉक्टर से मिलते हैं तो काफी वक्त जाया हो जाता है, अगर वो पहले जाके सजेशंस लेते अपने डॉक्टर से तो ट्रीटमेंट आसान होता, ये भी है?
हाँ बिल्कुल, अगर कोई चीज में भी, दैट इज ट्रू फॉर एनीथिंग, अगर आप कोई चीज में एंटी डिले करते हैं तो नुकसान पहुंचाती है खुद को ही किसी चीज के तरह से. तो अगर आप सपोज किसी को प्रोस्टेट प्रॉब्लम है, वो ट्रीटमेंट के लिए नहीं आ रहा है, तो विद टाइम क्या होता है, ब्लैडर डिकम्पनसेट्स. मतलब आप जैसे प्रोस्टेट ऑब्स्ट्रक्शन है, आपने कोई उसके लिए इलाज नहीं कराया पर्टिकुलर टाइम, इट आल्सो गेट्स वीकेंड विद टाइम. सो डेफिनेटली अगर आप बहुत डिले करेंगे तो फिर उसका असर पड़ता है, ब्लैडर भी वीक हो जाता है. समटाइम्स किडनी पे भी चेंज, अगर प्रेशर ज्यादा है, बैक प्रेशर चेंज किडनी पे असर डालते हैं. तो इसलिए मतलब बेसिकली डिले इज नॉट वारंटेड. हाँ ठीक है, ऐसा कोई अर्जेंट ऐसा नहीं कि हाँ आपको बिल्कुल इससे किसी की लाइफ नहीं जा रही है, इट इज नॉट लाइफ थ्रेटनिंग सिचुएशन, बट देन द सूनर द बेटर, एंड इट्स ऑलवेज दैट इन मेडिकल ट्रीटमेंट, सूनर द बेटर.
Exactly. बहुत लंबे समय तक हमें इग्नोर नहीं करना चाहिए symptoms. And anyways, it's kind of a social stigma as well. If you are at a public place, many people I have seen, they restrict themselves indoors because
Yeah,
they don't
overactive
have
bladder is a overactive bladder is a problem which is not only hampering his personal life, it is hampering in all spheres of life. Because पर्सनल लाइफ में उसको ही कैनॉट ट्रैवल फ्रीली, उसे कहीं भी जाना है बस में कहीं भी, तो ही इज ऑलवेज अफ्रेड ऑफ ट्रैवलिंग, है ना. ही इज नॉट गोइंग टू सोशल प्लेसेस बिकॉज अगर वहाँ टॉयलेट अवेलेबल नहीं है तो ही विल बी रशिंग, ही विल फाइंडिंग कहाँ जाना है, रश करता है. तो ही ही इज नॉट एबल टू स्लीप इन नाइट प्रॉपर्ली बिकॉज उसे रात में केवल उठना पड़ता है यूरिन जाने के लिए. So if he is not able to sleep, his daytime productivity will also decrease. Even at workplaces, if there is no toilet around, he will be disturbed. कैसे काम करना है, क्या करना है. All this lead to his sexual effectiveness भी घट जाते हैं, पेशेंट मेंटली फिट नहीं रहते हैं. तो there it's like it's not just one aspect. It is कहने को एक बस एक छोटी सी बात है कि आप, लेकिन it has impact on all his spheres of life, and overall his quality of life gets affected. सो दिस इज, ऐसा नहीं सोचना चाहिए कि हाँ सर चलो कोई बात नहीं है, कोई बड़ी बात नहीं है, इसके लिए डॉक्टर से क्या डिस्कस करें, या तो होता ही है या हो जाए. मतलब he should, the person should think it's not his only his one problem, it is affecting all his spheres of life, and पूरी quality of life खराब हो रही है. So why not take timely treatment and get rid of this.
I completely agree with you. And viewers, that's the whole purpose of having this session. And that's why we are celebrating this World Continence Week, to spread awareness, to let you know, see, this is an issue. These are the symptoms, these are the causes, these are the treatment options available. Please go and consult your doctor in case you see any of the signs of symptoms. Now, doctor, as you very rightly said that it's curable, we have good treatment options. What are the treatment options available for an overactive bladder?
If we see the guidelines, the first treatment options which are available are behavioral therapy and lifestyle modification. कहीं भी किताब ये नहीं कहती कि पहले आपको मेडिसिन आप या सर्जरी आपके फर्स्ट लाइन ट्रीटमेंट है. सो पेशेंट शुड नॉट बी अफ्रेड कि हाँ मैं ऑपरेशन करना पड़ेगा जाते ही. ऑपरेशन इनफैक्ट इज सर्जरी द लास्ट पार्ट ऑफ दिस होल प्रोटोकॉल ऑफ ट्रीटमेंट. सर्जरी बहुत कम करते हैं, रेयरली रिक्वायर्ड होती है. मैक्सिमम केसेस रिस्पॉन्स टू मेडिकल मैनेजमेंट एंड ट्रीटमेंट which we teach the patient. So coming to first thing, behavioral therapy and lifestyle changes. If we start from first thing, obesity is one of the major reasons which cause overactive bladder. So and obesity is kind of another big issue with with aging and worldwide everybody's all the countries are affected with this problem. So obesity has to be taken care of. Weight control is very important, and losing weight has a lot of impact on overactive bladder. Once you lose weight, a significant amount of weight, and your obesity comes down, definitely will be improved. So obesity एक major reason है और losing weight एक important treatment है उसका for overactive bladder. Next is like smoking and drinking. As I already mentioned, smoking is a very important cause of overactive bladder in young patients especially, and alcohol in all ages. So and if we take alcohol in the evening or night, then whole night patient has to avoid multiple times. So after 6 p.m. in the evening, we ask the patients to reduce their liquid intake, and especially tea, coffee, alcohol should be restricted after 6 p.m. as much as possible. So in the evening, because we want when the patient sleeps by 10 or 11, he should be able to pass most of the urine which is in the bladder, and so that he sleeps with almost an empty bladder. तो उसमें आप symptoms उनके अपने आप कम हो जाएंगे night time में. Fluid restriction is another good thing because of late we have been starting stressing on this point because बचपन से हमारे दिमाग में डाल दिया जाता है बहुत पानी पियो drink a lot of water. So many people have this habit of drinking a lot of water, and this is one of the causes of overactive bladder can also be drinking a lot of water. So what as a urologist I suggest that drink a good amount of water in moderation. We don't need to drink a lot of water, and not too little either, because if you drink too little water, then that itself is a problem for so many it will cause so many problems. So I don't say don't drink too little. You should drink enough amount of water so that your urine is clear. It should be almost pale white. I mean, it should not be dark yellow. Light yellow and white is the acceptable color of urine. And especially in elderly people, we ask them to drink a little less of water because their lifestyle is not very stressful, and they are usually at home in ACs or resting at home. So they need to reduce their water intake, not to the level of what a young person require. Normally a requirement for a young person will be around 3 to 4 liters in a summer season, and in elderly it can be around 2 to 2.5 liters is sufficient. And it is not just water, it is all the liquid combined together. It's a big misconception because there's something called bladder diary which we often use in these kind of patients when we want to know the cause of his overactive bladder. So in that bladder diary, we ask the patients to maintain a diary for around 1 to 2 days, for 48 hours preferable, where उसको हम ये कहते हैं कि वो कितने बजे कितना लिक्विड और किस टाइप का लिक्विड ले रहे हैं वो मेंशन करें, और कितना यूरिन कितने बजे पास किया वो मेंशन करें. And in doing so, we come to know their intake pattern, the types of fluid they are taking, and the timings and the quantity of the fluid they are taking, and the output, like कितने frequency है, and bladder capacity कितनी है, urine कितना volume pass करते हैं maximum. So all this we have a lot of information from bladder diary. So when we are not sure about the reason for his overactive bladder, we go for bladder diary, and it is a very useful tool to determine what is the reason for the patient's overactivity. And you'll be surprised that I have treated few patients of overactive bladder who had just one problem of drinking a lot of water, and they didn't even realize this. That patient, I had one patient who was like suffering from last 2 years, a young female of 20 years of age, and she has seen all doctors and she has taken all medicines which are possible, and then she was not getting all right. And so I just asked her, how much water do you drink? And she said, I drink a normal amount of water. I mean, she was like okay about it. So I said, okay, I just need a bladder diary from you, and just make diary and give it to me for 2 days. And when I saw that diary, I was surprised to see that she is drinking 6 to 7 liters of water per day. And then I asked her, why do you drink so much of water? She said, like, from my childhood, I've been told that, drinking a lot of water is good for health. So this is normal for me. I drink this for the last so many years. And so I said, this is the cause of your problem, and you cut down your water and you see the effect. And after few weeks, you were totally okay without any medications. So over drinking is also not advisable. You should drink normal amount of water, which is around 2 to 3 liters for your elderly, and 3 to 3.5 liter 4 liter maximum for an active, young person. And a simple, way to confirm your accuracy is just see your color of urine. It should not be dark yellow. It should be light and or a clear urine. So drinking water is one important thing. Then, as I said, tea, coffee, alcohol, smoking. Then salty and spicy food. You have to avoid salty, spicy food and acidic drinks like, cold drinks. We have all the aerated drinks and all. We have to avoid these kind of drinks. Then obesity I already talked about. Next thing is like bladder training. Now in bladder training, what we do, we ask the patients to control whenever they feel the urge to pass urine. तो हम उनको कहते हैं कि आप कुछ देर के लिए अपने को कंट्रोल करने की कोशिश कीजिए. Try to increase this time of urinating. जैसे आपको फ्रीक्वेंसी हर 1 घंटे में जाने की है, तो हम पेशेंट को समझाते हैं कि आपको जब यूरिन लगता है आफ्टर 1 hour when you want to go, you try to delay it for 5 minutes or 10 minutes. उस तरह से your bladder will try to hold urine for some more time, and with gradual exercise. You cannot, आप सडनली 1 घंटे 2 घंटे में नहीं आ सकते. इट इज नॉट पॉसिबल कि आप हर घंटे यूरिन जा रहे हैं तो आप 2 घंटे में सीधा आ जाइएगा. बट देन ग्रेजुअली इफ यू ट्रेन योर ब्लैडर टू होल्ड यूरिन टू होल्ड फॉर 5 more minutes, for 10 more minutes, तो इस तरह से धीरे धीरे करते करते ब्लैडर विल स्टार्ट accumulating more amount of urine for more time, and you will get more interval between your urination, this thing. So that is another important aspect, bladder training. Then comes Kegel exercises, जिसमें कि हम पेशेंट को एक्सरसाइज सिखाते हैं उनके ब्लैडर मसल्स को स्ट्रेंथनिंग करने के लिए, पेल्विक मसल्स को स्ट्रेंथनिंग के लिए we teach exercises. But then Kegel exercises भी जो हैं वो they are very much not done properly by the patients. पेशेंट्स ने कहीं पे यूट्यूब में देख लिया या कहीं पे पढ़ लिया लिटरेचर कुछ भी और अपने से शुरू कर देते हैं करना, बट वो ढंग से नहीं करते. बिकॉज what is most important in Kegel exercise is the muscles which they are contracting. If they're not on the right muscles, तो फिर फायदा नहीं होगा. वो कहते हैं, कई पेशेंट्स come and tell us कि सर हम तो एक्सरसाइज बहुत दिन से कर रहे हैं, हमें फायदा ही नहीं मिल रहा है इससे. Then we ask them how you do it. तो हम जब देखते हैं तो वो they are actually contracting the abdominal muscles. So there's no point contracting abdominal muscles and saying कि हम एक्सरसाइज कर रहे हैं. Until unless the pelvic muscles are contracted, कोई फायदा नहीं होगा. Or to contract your pelvic muscles properly, you need to get yourself properly trained by any either urologist or physiotherapist who knows exactly कौन सा मसल्स को contract करना है, and they can, and I mean we teach the patients कि हाँ आपको you have to contract this kind of muscles, and we do it, we ask them to do it in front of us. When we are sure that they are doing it correctly, then we teach them कि हाँ कितने cycles में करना है, कितनी बार करना है. So for Kegels or suggest patients that you go and meet your urologist and then learn proper way how to do Kegel exercises, not just anything which you are seeing on YouTube and you start practicing yourself. ज़्यादा फायदा होता नहीं है उस चीज से. तो exercises help a lot. Then next comes medications. उसके लिए we are there to help you because there are few medications which are available and they are quite effective. So even if you don't find a cause and even if all the factors are normal, medicines do work in most of the cases and उससे फायदा होता है. Patients definitely improve with medications. Finally, for those patients जो medications से improve नहीं करते हैं, lifestyle changes improve नहीं करते हैं, everything fails on them, then we have surgical options for them, जिसमें कि आजकल botox therapy एक available option में है. सेकेंडली हम ऑगमेंटेशन करते हैं, ब्लैडर का कैपेसिटी छोटी तो कई बार उसको बड़ा करना पड़ता है, और भी ऑप्शंस होते हैं. देन मतलब these are the last options required in very few people. You can say hardly 1% or not even that number of patients. Most of them respond with conservative management.
Right. तो बहुत सारे लाइफस्टाइल चेंजेस हैं जो करके आप जो सिम्टम्स है उन्हें रिड्यूस कर सकते हैं. ओबेसिटी कम करना बहुत जरूरी है. हेल्दी लाइफस्टाइल, व्हाट यू आर ईटिंग इज वेरी इंपॉर्टेंट. What you are drinking, how much you are drinking is again important. Excess of everything and anything is bad, and that includes water as well. So please don't go by that old age saying कि बहुत पानी पियो. पानी आपकी नेसेसिटी, आपकी रिक्वायरमेंट, आपके वर्क कंडीशंस. अगर आप खेत पे काम करने जाते हैं, बहुत स्वेट करते हैं, तो शायद आप ज्यादा पानी पियोगे, लेकिन आप एक कंट्रोल्ड एनवायरनमेंट में है जहां आपका वाटर इनटेक तो बहुत हो रहा है लेकिन वो निकल नहीं पा रहा है. तो व्हाट्स द यूज जस्ट इसलिए कि लोग कहते हैं बहुत पानी पियो, तो ऐसा मत करिए. यही इस पूरे सेशन का वो है जो हम हमारे व्यूअर्स तक पहुंचाना चाह रहे हैं. और जैसे कि डॉक्टर ने कहा कि जो वीडियोस देख के आप करते हैं, अगर वीडियोस देख के हम सब इलाज कर पाते तो डॉक्टर्स की जरूरत नहीं होती. डॉक्टर्स आर हियर, सो प्लीज गो एंड गेट the right advice from them. Doctor, I'll simultaneously take few of our viewers' questions as well. Abhishek Mishra है हमारे साथ पूछ रहे हैं, are there other lifestyle steps to take in order to manage OAB?
Most of them I think I have already mentioned. आप साथ में one or two things which I probably would like to say again. Like another one thing is constipation. जैसे मैंने पहले बताया कि पेशेंट की constipation रहता है तो it causes compression of bladder को वो push करता है, उसके जो fecal matter होते हैं, so that is another cause of overactive bladder. So try to avoid constipation, have a healthy diet and healthy lifestyle so that there's no constipation, आपका पेट साफ रहेगा. तो bladder and bowel are quite related issues. So many people who have bladder issues also have bowel issues and vice versa. So take care of your bowel and your bladder will be also okay with that. So दोनों चीजें ध्यान साथ रखना पड़ता है.
Okay. And doctor, ये symptoms अगर नजर आते हैं किसी को तो क्या उन्हें करना चाहिए?
जैसे मैंने पहले कहा, don't suffer in silence. If you have these symptoms, please see your doctor. They are जैसे मैंने कहा, we'll first discuss the patient and we try to find out the cause of the patient. किस particular patient में cause क्या है? Because every patient might be having different cause. Somebody may be obese and having some medications with age. Somebody a patient might having prostate enlargement. Other patients might be mainly into smoking and drinking. So we have to look for the cause in that particular patient and advise them accordingly. After that, depending on the reason, we teach them their जो भी physical requirements हमें exercise सिखाना है या जो भी बताना है. So and then medications obviously we add along with those. So definitely, I mean, you need to meet a doctor and then we will see what to do further and you will improve with time gradually. No doubt, you will be better with the medicines.
Fair enough. चूंकि आपने प्रोस्टेट का जिक्र किया और आपने बताया कि प्रोस्टेट एनलार्जमेंट भी एक बड़ा रीजन होता है मेन में व्हिच इज रिस्पांसिबल फॉर एन ओवरएक्टिव ब्लैडर. सो उस पे भी थोड़ा हम चाहेंगे कि आप एलैबोरेट करें.
हाँ जी, एक्चुअली होता क्या है, प्रोस्टेट एक ग्लैंड होता है जो यूरिन के ब्लैडर के जस्ट नीचे होता है और पेशाब का रास्ता उसके थ्रू निकलता है. तो जब वो ग्लैंड बड़ा हो जाता है तो यूरिन के रास्ते को कंप्रेस करता है. तो ड्यू टू दैट कंप्रेशन इफेक्ट यूरिन का जो फ्लो है वो कम हो जाता है एंड यूरिन की कई बार पेशेंट को जाना पड़ता है, दिन में रात में कई बार उठना पड़ता है एंड पेशेंट समटाइम्स फील दैट ये नॉर्मल है विद एज के रात में 4 बार उठना नॉर्मल है. बट एक्चुअली ऐसा नहीं है, ये आपके प्रोस्टेट एनलार्जमेंट का एक लक्षण है जिसके लिए स्टार्टिंग में हम प्रोस्टेट एनलार्जमेंट के लिए भी एंड उसमें प्रॉब्लम क्या होती है कि जब ब्लैडर को लगता है कि सामने प्रेशर है, आई मीन ऑब्स्ट्रक्शन है, तो ब्लैडर स्टार्ट्स कंट्रैक्टिंग मोर टू पुश आउट यूरिन. So that causes kind of urgency to the patient and patient has to rush to the toilet. So because of the prostate enlargement, so many symptoms are there, right from decreased urine flow, increased urine volume in the bladder, obstruction, I mean overactive bladder. आपका patient has sense of incomplete evacuation of urine कि मैं urine पूरा निकल नहीं रहा है, ऐसा feeling आती है, multiple times जाना पड़ता है, night में उठना पड़ता है. So many symptoms are associated with prostate. Overactive bladder is one of them. So prostate के symptoms भी पूरी तरह से treatable हैं and बहुत फायदा हो सकता है just with medication alone. And those people who do not respond to medicines, surgery is always there and prostate surgery has been there from like ages. काफी टाइम से करते आ रहे हैं and it is a relatively simple surgery, not much complicated. सब दूरबीन से होता है आजकल, everything is done by endoscopic route and so we don't need to make any cuts or anything. So it is a 1 to 2 days procedure. I mean total from stay and operation मिला के. And it's not a not a major surgery, not a supra-major surgery you can say. So people should not be afraid of getting treated for prostate themselves. चाहे वो medical treatment हो, surgical treatment हो, सब कुछ available है and we are doing it day in and out and day out. So patients should be seeing us for that, even that problem.
Right. So the best part is that we have good treatment options available. It's curable. What is required is to go and meet your urologist if you see any of these signs or symptoms. One more thing, doctor, कि जब भी हम urinary tract की बात करते हैं, bladder की बात करते हैं, तो बहुत सारे दूसरे organs भी हमारी body में है जो associated है. Like kidney जो हमारी body में filter का काम करती है, urine बनाती है basically you can say. Bladder is there to store it, जैसा कि आपने कहा. Men में prostate भी होता है because जैसा कि आपने कहा it goes through it, the passage. तो ऐसे में अगर overactive bladder का issue है तो क्या ये हमारे दूसरे associate organs को भी involve करता है या उनको भी affect करता है?
जनरली ओवरएक्टिव ब्लैडर अगर रीजन अगर कई बार ब्लैडर छोटा हो जाता है, ब्लैडर कैपेसिटी कम हो जाती है, तो ऐसे केसेस में इट कैन अफेक्ट द किडनीज. नॉट इन ऑल केसेस, मोस्ट ऑफ द केसेस अफेक्ट नहीं करती है, बट देन अगर ब्लैडर कैपेसिटी स्मॉल हो गई फॉर व्हाटएवर रीजन, it can affect the kidney. And as I said, prostate is a big problem because prostate बढ़ जाता है sometimes, then it causes a lot of blood pressure changes to the kidney and sometimes even kidneys start failing and creatinine बढ़ जाता है, kidney खराब हो जाती है. We have seen patients, we regularly see patients with with obstruction of prostate causing changes to the kidney is damaged and patient goes for dialysis, creatinine बढ़ जाता है. So these are patients who come to us quite late. They have these problems most, and many patients who have prostatic enlargement, they don't see us on time, and they miss out on they are developing cancer in prostate. They don't they don't come on time, so they are not diagnosed in timely manner. बाद में लेट से आते हैं when all they already spread, and then they come to us. So any person, anyone having enlargement prostate after 60 years of age should see a urologist. There's a simple blood test called serum PSA जो हम कराते हैं. Every year we do it for all our patients more than 60 years of age, and it can detect prostate cancer at a very early stage if it is done regularly in screening, and it is totally curable if it is detected at timely manner. It is that even prostate cancer is totally curable. So that's another message to our audience, that follow our male audience, that please do not delay your symptoms. अगर prostate symptoms आपको हो रहे हैं, ट्रीटमेंट कराइए, टेस्ट कराइए कि हाँ उसमें कोई कैंसर तो डेवलप नहीं हो रहा है, एंड उसका भी ट्रीटमेंट ऑप्शन अवेलेबल है. तो एवरीथिंग इज if you come in time, everything is possible.
Right, that's the main thing. If you go and seek the advice on time, that everything is possible. It's completely curable, even if it's prostate cancer. तो समय जाया ना करें, डॉक्टर से संपर्क करें कोई भी अगर आपको सिम्टम्स नजर आ रहे हैं. हमारे साथ चंद्रन अय्यर है, पूछ रहे हैं, how can OAB affect my health and my life?
I think मैंने इसके आंसर भी अपने टॉक में दिया है कि overactive bladder affects all aspects of your life. इट इज नॉट लाइफ थ्रेटनिंग सिचुएशन. ऐसा कोई लाइफ में रिस्क की बात नहीं होती है, लेकिन आपके सारे सोशल एस्पेक्ट्स, आपके पर्सनल एस्पेक्ट्स, आपके स्लीप, आपका ट्रैवल, आपका पर्सनल everything gets affected, so that way it is detrimental to your social and personal life, but then it is not life threatening that
right
way.
We have Adi Jain asking, sir, यूरिन लीकेज की प्रॉब्लम से बॉडी में वीकनेस और हेडेक होता है, तो ये क्या सिम्टम्स है?
Frankly speaking, they are not related as such, because urine leakage does not lead to weakness as such, and headache it has another it's a big topic, and it can be many reasons which can cause headache. It's just not linked to this urine leakage.
Right. Shivali Mishra is asking, sir, if someone is leaking urine during laughing or sneezing, is this belongs to OAB?
Yeah, no, this is kind of this is another topic altogether. This is called stress incontinence. ये एक incontinence का part है, not overactive bladder. Overactive bladder is different. Incontinence is incontinence जो होता है, that is another like broad topic. It is qualified in 3 top types: stress incontinence, urge incontinence, and mixed incontinence. तो जो हमने डिस्कस किया अभी overactive bladder में, that is urge incontinence, जहाँ पेशेंट को urge होता है और कंट्रोल नहीं कर पाता है. जो शिवानी पूछ रही है, दिस इज अ केस ऑफ स्ट्रेस इनकॉन्टिनेंस. अगर पेशेंट कोई स्ट्रेस लेता है, सपोज हंसता है, चलता है, दौड़ता है, एनी स्ट्रेसफुल एक्टिविटी ऑन द बॉडी, इट कैन कॉज इनकॉन्टिनेंस एंड इट कैन कॉज लीकेज ऑफ यूरिन. So this is kind of stress incontinence, and this is not a symptoms of but it is a separate entity altogether. For stress incontinence we have various reasons, options available, but it depends on the grade of incontinence. If it is severe incontinence, surgical option is much more effective in this kind of problem, and if it is a mild stress incontinence, then medications with exercises help quite a lot, but this is also totally treatable. So if anybody, and especially in females, it is very common in females, especially after normal child delivery, when sometimes pelvic muscles get weakened. So stress incontinence is a big part in females. So chalo isi although we're discussing something else, but then I'd like to teach the audience saying that if they have this problem, do come to us. This is also treatable and curable. Do not live, because we see many young patients with stress incontinence, even 30s, 40s, they are suffering with, and they never come out with it. So even if you're having stress incontinence, if you're leaking on laughing or running or any stressful activities, coughing, sneezing, this is again curable and treatable. Please visit us. We will take care of it.
Definitely. Dr. Alicia is here asking, during COVID, how do we manage, and any do's and don'ts for managing OAB? During vaccine, any medicine that need to be stopped?
No. I think it has been proved time and again that COVID vaccines are overall safe for almost all of us, and I think most of us are vaccinated by now, so I don't think it's an issue. And COVID, just like we are saying for everything, just follow COVID appropriate behavior everywhere where you are going, and then there's nothing special to be done in COVID for this OAB. It is just like routine in all of the cases.
Fair enough. We have Ashita Jha asking, if my OAB gets better, can I stop taking the medicines?
Yeah, this is a good question because we start medication, but when to end it and how to end it is a big question.
Right.
Because we cannot go for it for lifelong. So what we suggest the patients, we take the medicine, start the medication, and along with that start following lifestyle changes and behavioral therapy. As your lifestyle changes will take over, as your behavioral therapy will take over. Suppose you are obese, and that is the main reason for your overactive bladder. If you lose weight in 2-3 months, so that itself will take over and the medicines requirement will reduce with time. So gradually we withdraw the medicines. We generally, I mean, हम लोग इसको gradually withdraw करते हैं, ऐसा तुरंत नहीं, ऐसा नहीं कि sudden stop नहीं करते कई बार, otherwise sometimes symptoms recur. So gradually we withdraw the medicine and we ask the patients to go for more for lifestyle changes, to follow it rigorously, and if they're doing it properly, then usual medicine बंद हो जाती हैं after a few months of usage and patients are back to normal.
Okay, Geetika Sharma ka question hai, what if the medication doesn't work for me? Are there other treatment options?
Yeah, as I told them, medications come in third or fourth number in the treatment protocol, and then after medications are over, we have surgical options, we have sacral neuromodulation, we have Botox, we have other options available. Definitely, we have other options. So if the medicines are not working for you, we have to look for the cause and we have to treat it accordingly if required surgically also.
Okay, I have few more viewers who are asking questions on the same, line. Though we have already discussed this, but still, as questions are pouring on, Avinash Jain is asking: alcohol and caffeine consumption leads to OAB, and Ravina Patel on the same line: are there foods or beverages I should avoid to keep from making my OAB worse?
Yeah, already we have discussed
Yes.
alcohol, smoking, cold drinks, like your caffeinated drinks, tea, coffee, all this has a role because all these are bladder irritants. They irritate the bladder mucosa and they cause overactivity in the bladder. So they should be avoided as much as possible, and especially after evening because you don't want to run to the toilet whole night. So after evening they should definitely be avoided.
Right. And doctor, when a patient come to you, what's your first advice to them? That don't make any mistake, or you have already been very late, etc. I mean, what's the things that you tell them?
No, exactly. Now we don't say you're being late because you have stopped judging people because people come to us, quite late, no doubt. But then we start from the time when people come to us. From that day, we start from that day onwards
Right.
because they might be in some situation we cannot explain why they come too late, why they came late to us. Sometimes they might be their own, they're not no much aware or whatever. They're not. The situation might not be allowing them to visit the doctor, whatever reason it might be. So we have stopped being judgmental. So we just want to start from the point where patient comes to us and then whatever best we can do with the patient. If they are late, I mean sometimes things are not under our control, so we just tell them yeah, it's already late and things are out of our hands. But then most of them we are able to manage.
That's great. And one more thing, whenever we have any urine related issues, we feel that lemon water or other fruit juices are going to do good to us. Does this is it true, or the story is something else?
Yeah, I mean, we want to avoid acidic drinks, but then fruit juices and all, they're okay. I mean, they can be taken, no issues.
Okay. And as we are towards the conclusion of this session, any takeaway note or anything that you would like to share with our viewers?
I'd like to take this opportunity to request all my viewers to, do not suffer in silence. We are here to spread awareness in this week. You will hear many more such lectures and, many more such talks during this week. So kindly, once you realize your symptoms and your problems, please do visit your urologist, get yourself treated, get well soon. And we are here for that same thing. We'd like all of you to be, all right and be healthy. That's my message to all my viewers.
That was so nice of you. Thank you so very much, Dr. Ved Bhaskar, for your valuable time. And it has been quite an informative session for our viewers. We really look forward for many more such sessions in coming times. So thank you so very much.
Thank you, and thank you for such a great host. Thank you.
Thank you very much. And viewers, please, as the doctor have very rightly said, don't suffer in silence. If you have any of the symptoms, signs, any issue, please go and consult your doctor. That's really important. Don't waste time waiting. Thank you very much again, viewers, for your active participation. And for more information on how to diagnose, manage, and treat overactive bladder, stay connected to our FB page where you have all the updates on the overactive bladder. The FB page is Bladder Wellness. We are also available on YouTube, Twitter, Insta. Thank you and have a good day ahead.